Home health care and all its varieties is provided to you, and this plan kind of pays for itself using a prescription drug benefit. So I think it's a great fit for you. Let's take a quick look at it. So the objective is to get monies to pay for home health care services, right? Like skilled nursing, speech pathology, occupational therapy, and even a home health care aide, a specific person just to help you with these daily activities of living. And so that's what this plan does. So it's real simple. If you can no longer perform 2 of these 6 daily activities of living, then you get the benefits. What are the benefits? Well, there's 3 plans to choose from, and each plan offers a different daily benefit amount. I recommend Plan B that gives a total of a $300 daily benefit amount at the least. And what does that look like? Well, that means you get up to $300 a day for any combination of these services for up to 360 payments, right? It's full year of $300 a day. So every single day you could spend $300 on having 2 of these folks come in and help with something on this plan. So after 360 days, if you no longer needed the services for then another 180 days, then it starts over. So the benefit resuscitates itself. You get 360, you're off 180, and then you get 360 again. Over here, in addition to these home health care benefits from these folks, you get a separate individual who is the registered home health care aide. You get that person under Plan B. You get an $80 payment to you to help your payment for that person. You get that for 60 days. And again, it can be resuscitated if you no longer need for 180 days. So no hospitalization is required. That's big. That's uncommon. Typically, there's a hospitalization required to get these, especially the long-term care benefits for those long-term care policies. But the short-term care policy does not require that. So here's the kicker. The final thing is this policy basically pays for itself for the most part through this really cool feature of the prescription drug benefit. So here's how it works. For every prescription drug you get, they're going to give you money. I know it sounds crazy, but that's the way it works. They give you a prescription drug benefit. So if you are getting a prescription drug refilled, they give you $10 for every generic refill you do. If you get a brand name drug refilled, they give you $25 for every brand name drug that you refill. And you get to get up to $600 added up for all this for the year. So you can get $600 for the year. So let's say that plan costs you $40 a month times 12 months. $40 times 12 equals, let's see, 40 times 12. Sorry. I'm using the wrong one. 480. So 40 times 12 is 480, right? 12 times $40 equals $480 you've paid for the year if you were paying $40 a month for this plan. Well, that means you can get more out of the plan than you actually paid into it. And it's really easy to do. All they do is have you take the receipt, write your policy number on your prescription receipt, put it in the mail, and then they send you a check every time you do that. So you can collect up a handful of them and do it so that you get, a larger check each time you submit them, or you can do it every single time so you don't forget. But that is how you can basically pay for this plan on its own just through the prescription drug benefit. And let's take a quick look at the cost. So for this option, for this, I put in, Barbara's age and so forth. So for this option B, that was this one. Plan B, 300 here, 80 here you get, and then up to $600 back per year. That would cost you $45.74. So I was off by a little guessing earlier. $45.74. They charge $1.67 to pay you monthly. So a total of $47.41. So $47.41. So let's do that math again. 47.41 times 12. So 568.92 is the total you'd pay for the year, but you can get 600 back out of it. Plan potentially pays for itself, and that's before you've even gotten any of the benefits. And let's just say you got $300 a day on this benefit right here. So what would that look like? They tell you they'll give you $300 a day times, let's say you got that for 360 days. 360 days of that benefit. That's $108,000 of benefit that they've paid you for a plan that you didn't even necessarily net having to pay for anything for. So I think this is the best solution out there that I can find for helping bridge that gap for you. I hope you like it.
So this is a new benefit they just built in where now a family member who is acting as the caregiver at home can also receive a $3,500 caregiver lump sum to the loved one. You can use it any way you like. The cash is used for them as they please. You see there. So this is a new benefit built into this plan. It's been needed because so many people have a spouse who ends up having to be the caretaker, and they give up lost wages and things like that as a result of having to stay home, or a child. So now another benefit of this policy is you get a one-time $3,500 lump sum. So you have to do a little registration with them, and then they do that. So that's another wonderful added benefit.